Today, I'm going to talk about the West Nile virus. Now, this virus is kind of common and you may have heard the name before, but not know exactly what it is. It's a very tiny virus and it's way too small to even see, but it has a big impact on public health and the safety of everyone. So let's break it down together and talk about what is the West Nile virus. And in this picture is a mosquito stinging human skin. So what is the West Nile virus? So what it is it's a virus and it's the leading cause of mosquito-borne disease in the entire United States. Most diseases caused by mosquitoes is West Nile virus. But it is a virus, which means that it's not a living thing such as us or plants or bacteria, so it can't grow or reproduce or move on its own. Meaning that humans can't transfer this virus, it can't just go in the air and we attain it. It has to be in a body and then transferred to somebody else. So it has to get its cells inside of a living creature, and that's how it can continue to make more copies of itself. As this virus itself is a single-stranded RNA virus, so it can't copy on its own, it can't do that. It only can do that when it goes inside of a host body and takes over and essentially makes that cell a little virus factory full of West Nile virus. So there are other recognizable viruses that are in the same family, such as the Zika virus or the yellow virus, or the yellow fever, sorry. And these are all spread by mosquitoes. And that's what makes them their own family, because these are all different viruses fed by mosquitoes. And the only way that you can get infected from the West Nile virus is if something passes it on you, like the mosquito. It cannot do it on its own. That is the function of the West Nile virus. So how do I become infected? How do you get infected from West Nile virus? So what has to happen first is a mosquito has to bite an infected bird that already has that virus. The bird already has the West Nile virus in it, and now the mosquito doesn't, but it, in penetrating its skin and biting it, has now given the virus to the mosquito. So now that mosquito is infected and it goes and flies around everywhere and comes in contact with humans and others, and when it bites us and latches onto our skin, that's how we become infected. And now if you get infected, if you get bit by a mosquito that's infected, you become infected with the West Nile virus. As simple as that. And it'll start to reproduce inside of your body and your cells, taking over as a West Nile virus factory. And humans and other animals we're called dead end hosts. And that's because we don't spread the virus any further once we're infected. Meaning that once humans get infected with the West Nile virus, they will not be able to spread it to anyone else or anything else. That is only done through the mosquitoes. Now, what do you do if you get infected? First, you need to remain calm. It's important to know that 8 out of 10 people who get the West Nile virus don't even report having symptoms. They don't feel sick at all. Their immune system is able to overcome the virus and treat them before they even notice they had it. But however, there's still those 1 in 5 people, about 20%, that do feel the symptoms. And those are very similar to the flu. They include fever, headache, body aches, tiredness, and sometimes a rash or swollen lymph nodes. So it's very similar to the flu. It's very unpleasant, but it's usually not too dangerous. And that's what's important to know, is that you can get this and it's normally not too dangerous like the flu. But there are rare cases that can happen. About 1 in every 150 people who get infected with the virus, it can spread and attack their brain or their spinal cord. And it can cause serious conditions such as encephalitis, which is swelling in the brain, meningitis, which is swelling of the brain's lining, which is all very serious and very bad. And it can lead to confusion, seizures, or even comas in these patients. And unfortunately, they can be deadly as well. And older adults and people with weaker immune systems are the most vulnerable to these rare cases and are most likely to develop the serious problems that can come with it. So now, is there a treatment or a cure for West Nile virus? Sadly, right now, there is no treatment or cure that's going to kill the West Nile virus. There's also no vaccine to prevent it right now for humans. If someone does happen to get sick, doctors are able to treat these symptoms, but they aren't able to fully get rid of the virus. But the most that you can do is you can try and help treat the symptoms and make someone feel better. And what that can look like is giving fluids, because it's really important for your body to stay hydrated when you're feeling sick or have the West Nile virus. Take medications to reduce pain, like acetaminophen, or medicine to help with your fever. In some serious cases, you may have to go to the hospital and get care and breathing support if you're in one of these more serious cases. But most people do fully recover from the West Nile virus. And it normally is quickly, like the time of a flu within a week. But for more severe cases, it can take weeks to even months to get better from this virus. How can we protect ourselves and stay safe? So there's no vaccine, no cure, no way to definitely make sure we're safe. So the only way to do it is to prevent ourselves from getting. So the best way to protect yourself is to have no mosquito bites and to try to avoid them at all costs. So some simple things you can do are buying bug spray with important ingredients like DEET. They'll really keep away the mosquitoes. You wear long sleeve clothes, shirts, and pants, especially like at the morning and at night when there's a lot of heavy mosquito activity, just to cover your skin as much as possible. Keep your windows and doors closed and use like screens or something just to make sure that mosquitoes aren't just coming in and out of your house and you could have the chance of getting infected. And another very important thing is do not leave standing water. Mosquitoes love standing water, and if you leave them out, that's just a breeding ground and a place for them all to live and then possibly come and infect you. So it's very important not to have standing water anywhere, and that'll help with the prevention of mosquitoes and staying safe from the virus. So in conclusion, the West Nile virus had first shown up in the US and has since then become the most common virus fed by mosquitoes. It first showed up in New York around 1999, and ever since, the popularity has just streaked. And even though most people don't get seriously sick from this virus, a lot of people get it and it's like the flu, or they don't even feel any symptoms. It can be very serious and very life impacting for the people who do get affected by it and get damaged. So that's why learning about the West Nile virus is very important. And although many people may have heard of it but don't know much, learning more and being able to know everything is needed and how it works. And most importantly, to know the way this virus is. It doesn't spread through the air and just get infected and you are at risk all the time. It's only spread through mosquitoes, as that virus needs a host cell to be able to expand and keep infecting people. And luckily for us, humans will stop that cell once it gets in us. But if we have it, if we have the virus, we have to deal with that until it leaves. But we won't be infecting anymore. But with all that information, that's the West Nile virus. And I hope that you were able to learn more than you knew about it, and we can help stay safe and prevent this from happening and people having to deal with this virus.